The Philippines had its first HIV case in 1984. It prompted the government to institute an intervention to immediately address the new health issue. An intensified information dissemination campaign and surveillance was launched and implemented. In 1992, to further strengthen HIV response, Executive Order No. 39, which created the Philippine National AIDS Council, was promulgated by then-President Fidel Ramos. The council was further institutionalized by Republic Act No. 8504, otherwise known as the Philippine AIDS Prevention and Control Act of 1998. RA 8504 prescribed measures to control the spread of HIV in the country. It has been effective in controlling the further spread of the HIV. The Philippines then greatly benefited from the efficient implementation of the policies because it was able to control the increase in new cases of HIV as compared with some of our neighboring countries. All these happened when HIV cases were predominantly heterosexual in nature, where cases mostly came from female sex workers, from Subic and Clark, as well as Filipinos who have traveled or worked abroad. In the later years of 2000, change in the epidemic landscape started. Most of the cases then shifted from heterosexual to homosexual in nature. Majority of such cases were observed to proliferate among men having sex with men, MSM. In addition, certain areas of the country then were observed to experience the HIV epidemic due to the practice of people who inject drugs, PWID. This sudden shift in the epidemic landscape required an immediate policy change since existing law and implementing mechanisms became insufficient in addressing the epidemic. The Philippine National AIDS Council, together with the civil society organization, development partners, and other stakeholders, started to advocate for the revision and updating of RA 8504, which paved the way for the creation of the Philippine HIV and AIDS Policy Act. RA 111666, which repealed RA 8504 on December 21, 2018. Over the years, PNAC has continuously evolved its strategies from the early National AIDS Strategy to a more comprehensive AIDS Medium-Term Plan, AMTP. Currently, the 7th AMTP, which is the blueprint for the HIV country response for the year 2023-2028, is being implemented by members of the Council with the support from various civil society organizations, development partners, and other stakeholders. These are some of the PNAC activities for year 2023-2024. Advocacy activities. World AIDS Day. International AIDS Candlelight Memorial. PNAC links. Strengthening of local AIDS council. Engagement of Sangguniang Kabataan in HIV response. Issuance of the Department of Health during the National Health Staff Meeting, NHSM. Resolution 2024-04, leveraging multi-sectoral efforts to fight TB and HIV and accelerates the 8 priority health outcomes. And the issuance from the Commission on Higher Education, Memorandum from Office of the Chairperson dated August 21, 2024. Integration of HIV/AIDS and other STI education, prevention, treatment, and health promotion in the tertiary education. In partnership with Komisyon ng Wikang Filipino, Memorandum of Agreement to assist in the translation of HIV/IEC materials to different dialects in the country. PNAC Investment Plan was developed on March 27-34, 2023. Technical representatives from government agencies and civil society organizations crafted the communication plan for 7th AMTP. This aims to serve as a guide for the country's planners, implementers, and other stakeholders to determine where to invest their money. PNAC technical representatives from NGAs and CSOs developed the HR Roadmap Operational Plan last December 6-8. 2023 approved the document during the 14th PNAC plenary last February 28, 2024. The Council, in partnership with the Department of Labor and Employment, NCR, PFPI, and PNOI Plus, provided livelihood assistance to the eligible PLHIV individuals. As part of the PNAC's compliance with RA 11032, the PNAC website was officially launched in October 2023. Since then, it has been fully operational and accessible to users. This marks a significant milestone in its development. The PNAC also formulated the research agenda for the 7th AMTP. This agenda serves as a guide for research priorities and initiatives. Currently, the Council is assisting the Armed Forces of the Philippines on the revision of its HIV policy. The PNAC is also assisting in drafting the HIV policy for people in closed setting, also in the revision of the HMO undertaking of the Insurance Commission. The Council is also working on the revision of the Implementing Rules and Regulation RA 1166 for an efficient implementation of the 7th AMTP. The PNAC, through its chair, Secretary Teodoro Herbosa, will be pushing for an executive order for the intensification of the HIV country response. Together, we can end the HIV epidemic. Join us in the fight for health, equality, and human rights. Take the rights path.